So I'm going to transition into vaccines.
Hmm.
I want to get your opinion on it because I think that there's just a lot of misinformation, and also I think people need to gather their thoughts and actually read the research. But
Yeah,
what are your thoughts on the vaccine?
I could not be more positive. I mean, I feel like this really is the light at the end of a pretty dark tunnel for us. And I was hoping we would get a vaccine that worked in some respect. I think we all get the flu vaccine every year, and we all get the sense that it usually kind of works. We hope that even if we get the flu, it's not going to be as severe, and we probably see that. Um, and I was hoping for something like that, and what we got was something much more effective than that. With effectiveness in the 95% range. I mean, truly remarkable, and with a safety profile that seems amazingly good. Um, I think, occasionally I hear people express some anxiety about this being an mRNA vaccine, that the technique is a little bit different. I think every vaccine is going to be an mRNA vaccine, within the next few years. It's quicker, it's easier, it's safer, it's more effective. I think this is just the tip of the iceberg. So I can't. It is beyond me why people would not jump on it. I understand that people have concerns. I think in this case, those concerns have been taken care of, taken very seriously. And I think, fortunately, the data are not equivocal. It's not that you see a glass half full, half empty. This is a very, very full glass.
That's good to hear from you, and it makes me a little more confident. I'm one of those people who I'm a little skeptical,
Mm-hmm.
and I'm gonna wait to take it, but also I understand why people are taking it, and I'm not an anti-vaxxer at all.
Mm-hmm.
It's just I really want to kind of watch and see,
Yeah.
save my, and I just kind of don't understand the approach. For someone like me to get it when we can give it to someone that's 25 that has diabetes and
Yeah.
a kidney transplant. I mean, that sounds more reasonable to me, but that's just
I think that's an excellent point, and I've wrestled with that as well. If you had a choice, or if you check this box, your dose would go to, someone who's high risk in Chula Vista in a high risk zip code. I would probably do that, because I feel pretty safe. It turns out that when you look at the numbers of infections of people who are healthcare workers, um, the number of cases in San Diego County of the total cases in San Diego County, 7% are in healthcare workers, which is actually a lot given the percentage of the county that's healthcare workers.
okay.
If you dig deeper, it turns out a lot of folks, this includes everyone. This includes, LPNs, healthcare, you know, people who assist in the home with bathing, with, these kinds of things, who are not as trained, what have you. And when you look at it, a lot of folks in that group, in that 7%, are people from high risk zip codes, high risk demographics, who probably got infected, not in the healthcare setting, but nonetheless, the concern is that healthcare workers are at a high enough risk that it is justified. And furthermore, if we're not healthy, the system doesn't work. And that part in my, hat of doing surge capacity is a huge concern, because at the same time you get a surge in the community, you start getting more sick calls and people out for 2 weeks. And, that puts our readiness, and the number of beds we can staff way down.